Hello, I'm Rick Elion. I'm a clinical professor of internal medicine at George Washington University School of Medicine. I'd like to welcome you today and share this brief introduction to the expanding role of the pharmacist in HIV prevention. What do you know about PrEP? We continue to see a mismatch between the uptake of HIV prevention strategies and those individuals and communities who are at highest risk. This is especially true for men who have sex with men, MSM, an at-risk population that accounts for at least 70% of the 37,000 new HIV cases diagnosed in the United States annually. Despite a 1 in 2 lifetime risk for HIV infection within this demographic, the use of pre-exposure HIV prophylaxis, or PrEP, remains low. PrEP is a patient-centered, comprehensive approach to reducing the risk of HIV acquisition, an approach grounded in disease awareness and behavioral risk reduction. The word PrEP, however, has become synonymous with the once-daily single-pill regimen of tenofovir disoproxil fumarate plus emtricitabine, TDF, FTC, currently the only FDA-approved antiretroviral regimen for HIV prophylaxis. Combined, these two nucleoside reverse transcriptase inhibitors prevent viral DNA replication. Once-daily TDF-FTC has greater than 90% efficacy for prevention of HIV acquisition when used in conjunction with proactive risk reduction measures. Models prioritizing PrEP in the young Black and Hispanic MSM population, with emphasis on overall strategies for increasing PrEP use by these at-risk individuals, have delivered both individual and public health benefits. Yet, there's a serious shortage of providers who can handle the number of people in the U.S. who need to be tested for HIV and treated prophylactically. This calls for the increased capacity of systems providing HIV prevention and an increase in the number and diversity of available providers and practice settings. Together, these critical components equal improved access to care and ultimately improved health outcomes for those at risk for HIV acquisition. Pharmacists across diverse practice venues are well suited to provide HIV prevention. Typically, pharmacies are conveniently located within the flow of everyday life and offer services within a socially normalized setting, free of stigma. And importantly, pharmacies provide information and services to individuals who otherwise may have limited access to health care. But beyond their accessibility, pharmacists have an established track record for providing effective primary and secondary prevention services and chronic disease management. Many studies have demonstrated that pharmacist participation in chronic disease management, including HIV care, improves patient engagement, treatment adherence, and clinical outcomes. Although some aspects of HIV prevention care, such as taking a sexual history, may be new or even challenging for the pharmacist, the overall skill set needed is part and parcel of the pharmacist's daily practice: patient assessment, patient education, monitoring, and support. In this clinical context, assessment comprises HIV testing, HIV risk assessment, and determination of both PrEP candidacy and PrEP eligibility, essential first steps in the CDC, United States Public Health Service guideline-driven activities associated with HIV prevention care. Patient education drives and bridges the entire care continuum. It's key to safe and effective TDF-FTC initiation, on-treatment monitoring and interval testing, ongoing adherence support, and risk reduction counseling. Effective pharmacy-based programs have demonstrated not only the feasibility of engaging at-risk individuals in HIV prevention care, but also acceptability of these services, high levels of adherence, and optimal treatment outcomes. These programs exemplify pharmacists' real-world opportunities to expand access to HIV prevention services and engage patients who might otherwise not seek information and care. Armed with the most up-to-date PrEP principles and protocols, pharmacists can effectively respond to the epidemiologic imperative for enhanced uptake of PrEP at both the individual and community levels. And now, I'll turn it over to today's presenters.